Good morning, all. I am Dr. Abhijeet Shrivastava, Assistant Professor in the Department of Pediatrics. So today we are going to talk about optional vaccines. So optional vaccines is a very important topic in vaccinology. So let's start. So what are the optional vaccines we are going to discuss further? We are going to discuss about hepatitis A, typhoid, HPV, varicella, influenza, rabies, meningococcal vaccine, Japanese encephalitis, cholera, yellow fever. This is the vaccination schedule, IAP vaccination schedule, in which all the vaccines which are there in National Immunization Schedule as well as the optional vaccines are being mentioned here. Okay, so we are going to go in detail about these vaccinations. So we'll start with varicella. It is to protect chickenpox. So it is a live attenuated vaccine, varicella zoster vaccine, Oka strain, induces both humoral mediated immunity and cell mediated immunity. Freezed, dried, lyophilized. Each dose contain 1300 to 2500 PFU, minimum 200, monovalent as well as MMRV, that is a quadrivalent vaccine available. MMRV contains measles, mumps, rubella, and varicella. Stabilizer is monosodium L-glutamate. Monovalent available in India currently by the names Varipede, Varilrix, Biovac V, Verivax, Nexipox, Zuvicella. So these are the brands are available which are available in India. Immunogenicity is like zero conversion rate with first dose is 86%. And after 8 to 12 weeks, when we give second dose, it is 99%. MMRV also has a similar zero conversion rate. Adolescent 80% to 90%. Breakthrough varicella, 2 doses recommended in more than 12 years to reduce the risk of breakthrough infections due to waning immunity. Duration of protection is 15 to 20 years. This picture, which is depicting Priorix tetra, is MMRV. It is, the dose is 0.5 ml subcutaneous, and minimum age is 12 months. 15 to 18 months is the second dose. Ideal time is 15 to 18 months. Booster 3 months after or up to 4 to 6 years of age. More than 12 years, 2 doses 4 weeks apart. It is stored at 2 to 8 degrees centigrade, protected from light. Shelf life 2 years. Use within 30 minutes of reconstitution. Varicella again. Locally, it produces pain, redness, and swelling at vaccination site. Injection site rash, fever, and a systemic Varicella like rash in around 5% cases. Contraindication, pregnancy, avoid 3 months post-vaccination also, history of anaphylaxis or immunocompromised patients. High risk, uh, humoral mediated immunity disorders, HIV, leukemia, steroid, chronic lung heart disease. Post exposure within 3 days of exposure, efficacy is 90% and up to 5 days, 7%. Hepatitis A, killed vaccine, live attenuated is also available. Killed is available by the name Havrix 720, inactivated hepatitis A vaccine. HM175 GBM strains and grown on MRC, human diploid cell lines. Formalin inactivated. Adjuvant is aluminum hydroxide, immunopotentiating reconstituted influenza virosome, combined hepatitis A and B. Hepatitis A live vaccines, which is freeze-dried live attenuated hepatitis A vaccine by the name BioVac A. It is available. H2 strain of human diploid cell, KMB17, age at 12 months, efficacy killed 2 doses 90 to 95%, live 100%, 95% for post-exposure prophylaxis. WHO recommended both. Lifelong immunity, anamnestic response. Hepatitis A, it is 0.5 ml intramuscular. Contraindication, anaphylaxis to previous dose. Storage 2 to 8 degrees centigrade. Protect from light. Use within 30 minutes of reconstitution. Hepatitis A, local reactions, pain, swelling. All healthy children. High risk groups, chronic lung disease, immunodeficiency, transplant recipients, travelers. Post exposure within 10 days of onset of illness of index case. So now we'll talk about typhoid vaccine. It's a public health problem. Children 1 to 5 years are very much involved. CFR is 1 to 4% in treated and 10 to 20% in untreated. Drug resistance is also seen. Typhoid incidence in overall population. So age wise, middle age, it is 10 to 100 per 100,000 per year. So incidences is actually, it's been mentioned like which part of the world is affected and how it is affected. It's a global burden. So typhoid is whole cell inactivated vaccines. Virulence, capsular polysaccharide vaccines, VIPS. Live attenuated typhoid 21A is not available. Virulence conjugate vaccines, typhoid conjugate vaccines. WHO has recommended that countries consider the use of typhoid vaccines for high-risk groups and population and for outbreak control. Whole cell inactivated vaccine. It's a heat-killed phenol preserved acetone inactivated whole cell. Salmonella typhi, Salmonella paratyphi A and B. 2 doses subcutaneous 4 weeks apart. More than 6 months of age. Efficacy 60 to 70%. Revaccination every 2 to 3 years. Interfered with Vidal. Adverse effects like fever, headache, severe local pain removed from public health programs. So this is Typhoid VIPS. Purified antigenic fraction of VIPS. 0.5 ml is 25 micrograms of purified polysaccharide. Stable for 2 years. Stored in 2 to 8 degrees centigrade. Not immunogenic for less than 2 years. No immune memory. So not recommended for less than 2 years as it's a polysaccharide vaccine. Efficacy 50 to 75%. Single dose at 2 years and repeat every 3 years. VIPS conjugate. So with Pseudomonas aeruginosa, exotoxin A, with tetanus toxoid, Typhoid TCV licensed. Single dose 0.5 ml, more than 6 months. 25 microgram purified VIPS conjugated to TT. Improved seroconversions. This is Vivotif, that is typhoid vaccine live oral. Live attenuated typhi 21A strain of Salmonella typhi. Two to 6 million live lyophilized bacteria capsule. Induces intestinal mucosal immunity. 3 doses on alternate days on empty stomach. Capsule swallowed intact. No antibiotics for 3 days prior, 7 days after. Contraindication immunocompromised, and it is also repeated every 3 years. HPV vaccine, human papilloma virus vaccine. Reasons: it's a highly transmissible transient anogenital cancer. Lag period 15 to 20 years. Natural immunity, intraepithelial basement membrane, quadrivalent and bivalent, recombinant DNA, cellular immunity and IgG antibodies. Pre-adolescents 9 to 13 years, higher immune response. Do not protect if infection has already occurred. Near complete protection against precancerous lesions. Girls 11 to 12 years is ideal age, minimum 9 years. So bivalent vaccine available. Efficacy for CIN1 is 92%, for CIN2 is 95%. HPV2 L1 protein 1618 for genital warts. Doses 0.16 months. 0.5 ml intramuscular. Local pain, swelling, erythema. Store at 2 to 8 degrees centigrade. It's quadrivalent vaccine, HPV, which contains 6, 11, 16, 18 strain. Doses is like 20 micrograms, 40 micrograms, 40 micrograms, and 20 micrograms. Aluminum containing adjuvant is 225 micrograms. HPV4 L1 proteins of serotype 6, 11, 16, 18. Aluminum containing adjuvant 0 to 6 months, that was 0.16. Efficacy after 3 doses is 99%. It prevents from genital warts, vaginal intraepithelial neoplasia, vulvar intraepithelial neoplasia. Prevention may not be the right term, but it provides protection. So this is Nonavalent HPV. So it contains 9 strains, and CIN2, the protection is 96%. For verbal CIN, it is 96.7. For vaginal, it is 2 by 3. Not available in India, but now, currently, for past 6 to 8 months, it is available. Influenza vaccine. 3 antigenic subtypes, A, B, and C. Compositions altered yearly. Prevalent circulating strains. Inactivated vaccines, trivalent. Whole cell vaccines, significant split product, subunit surface, highly immunogenic, minimal adverse effects. 15 microgram of H influenza A strain, that is H1N1 and H3N2. Antibody titers peaks by 2 to 4 weeks, falls by 50% by 6 months, stable 2 to 3 years, 0.5 ml subcutaneous, minimum age 8 months, single dose at 9 months. Adverse effect is fever and malaise. Influenza, high risk groups, immunodeficiency, HIV, chronic cardiac pulmonary diseases, sickle cell, oral steroids. Live attenuated healthy children 2 to 5 years, efficacy 82%. Intranasal is a quadrivalent. JE, Japanese encephalitis. Reasons: 30% CSF, permanent neuropsychiatric sequelae. Hyperendemic states: UP, West Bengal, Karnataka, Andhra Pradesh, and Assam. This is the percentage distribution of mortality reported in communicable diseases. So H1N1, 16%. Pneumonia, 23. Acute respiratory pulse, 23. This is the confirmed cases of Japanese encephalitis in India, so which is on rising trend. World over, following vaccines are available for use: mouse brain derived inactivated Japanese encephalitis vaccine, that is JE vax. Inactivated primary hamster kidney cells with P3, this is China made. Live attenuated cell culture derived SA14-14-2. Inactivated vero cell culture derived polar strain 821564XY. Live attenuated recombinant SA14-14-2 chimeric vaccine. Inactivated vero cell derived Japanese encephalitis vaccine. So live attenuated cell culture derived SA14-14-2, genetically stable neuroattenuated strain, 0.5 ml subcutaneous, 3 microgram content, 2 doses, 8 months, 2 years, booster by 7 years. Immunogenicity single dose 85 to 100%, phosphate buffer solution. There are two 31 endemic districts. Visitors to endemic area is advisable to get the vaccine. Adverse effects is fever and malaise. Vaccination prevention control measures should be taken. Meningococcal vaccine, serotypes A, B, C, Y, W135, two types, meningococcal polysaccharide vaccine, that is MPSV, and meningococcal polysaccharide protein conjugate vaccine, MCV. MPSV is bivalent AC or quadrivalent, lyophilized, sterile water diluent, stored at 2 to 8 degrees centigrade, more than 2 years indication, T cell independent, efficacy 85%, duration up to 10 years following immunization. MCV, quadrivalent diphtheria toxin as carrier protein, 4 microgram of vaccine is equal to 48 microgram diphtheria toxoid, 0.5 ml intramuscular, similar immunogenicity, efficacy is 80 to 85% by 3 to 4 years of vaccination, single dose, repeat after 3 to 5 years. Potential for herd protection and increased immunogenicity. Locally, pain and swelling may be present. Guillain-Barré syndrome is one of the adverse effect noted. 1 month interval between pneumococcal 13 and meningococcal ACWYD because they interfere in their immune responses. IAP recommendation, disease outbreak, Men A monovalent MCV, PSATT in mass vaccination. 2 primary dose 8 weeks apart. In splenic conditions like asplenia, hyposplenia, functional SC, or prior surgery. Complement component deficiencies, HIV, lab and health workers and travelers. Outbreak. If more than 3 cases of meningococcal disease have occurred in either an organization or a community-based outbreak during less than 3 months, starting at the time of the first confirmed or probable case, a primary attack rate should be calculated. Attack rate per 100,000, number of primary confirmed or probable cases during a 3 months period, number of population at risk into the 100,000. If the attack rate of the meningococcal disease exceeds 10 cases per 100,000 persons, then vaccination of the population at risk should be considered, keeping following factors in sight. Outbreak prevention and control actions. Active case surveillance, early diagnosis and prompt treatment, chemoprophylaxis of close contacts, household members, healthcare professionals, fostering disease awareness within the community, including the need to seek medical help and to avoid crowded places. Respiratory isolation of patients for 72 hours. Reactive vaccination of high-risk groups. Cholera. Public health program used preemptively in endemic areas and in crisis situations and not as outbreak control measure. Travel residents in endemic areas. Initially, parenteral vaccine was there. 30 to 50% efficacy by 3 to 5 months. So this is the Dukoral, the oral inactivated cholera vaccine. Inactivated whole cell Vibrio cholera with a recombinant fragment of the cholera toxin. Additional protection against enterotoxigenic E. coli. It takes 3 to 4 weeks to develop immunity in epidemics. Duration 3 years. Needs buffer solution. 2 doses 2 weeks apart. This is a bivalent 010139. Efficacy 80%. Duration 5-year post-vaccination. Does not require buffer. 2 doses 2 weeks apart. More than 1 year old. No adverse effects. Shelf life is 2 years. Stored in 2 to 8 degree centigrade. This is yellow fever vaccine. It's a live attenuated 7D strain from chick embryo, freeze dried, sterile saline as diluent, stored 2 to 8 degrees centigrade. Within 1 hour of reconstitution should be used. Zero 0.5 ml subcutaneous single dose. Immunogenicity and efficacy more than 90%. Adverse effects is like mild systemic adverse events like low-grade fever, headache, and myalgias that begin within days after vaccination and last 5 to 10 days in 10 to 30%. Serious adverse effects following immunization falls into 3 categories. First, immediate severe hypersensitivity or anaphylactic reactions. Yellow fever vaccine associated neurological disease like meningoencephalitis, GBS, bulbar palsy, Bell's palsy in first-time recipients by 3 to 28 days, rarely fatal in adults. Another one is yellow fever vaccine associated viscerotropic disease, multi-organ system organ failure, death after first dose by 1 to 8 days. Contraindications and precautions to yellow fever vaccine administration. Contraindications are allergy to vaccine component, age less than 6 months, symptomatic human immunodeficiency virus infection or CD4 or T cell lymphocytes less than 200 cells per millimeter cube, thymus disorder associated with abnormal immune cell function, primary immunodeficiencies, malignant neoplasms, transplantations, immunosuppressive and immunomodulatory therapies. Precautions: age 6 to 8 months, age more than or equal to 60 years, asymptomatic HIV infection, and CD4 T lymphocyte 200 to 499 cells per millimeter cube, pregnancy, breastfeeding. Traveler to endemic zones more than 9 months, endemic 9 to 12 months, contraindication less than 6 months, and should be given 10 days prior to the travel. The following countries and areas are regarded as having risk of yellow fever vaccine transmission, virus transmission. Africa and Americas. So Africa, it is Angola, Benin, Burkina Faso, Burundi, Cameroon, Central African Republic, Chad, Congo, like that. America, Bolivia, Brazil, Colombia, Ecuador, French Guiana, Panama, Peru. Rabies. So category of wound is very important. Wound care, very, very important. Available vaccines is cell culture vaccines, that is PCV, HDCV, and PVRV, and purified duck embryo vaccines. It's all lyophilized form. Sterile water is the diluent. Rabies vaccine. Shelf life is 3 years. Used within 6 hours of reconstitution. Vaccines induce protective antibodies in 99%. Duration is 5 to 21 years. Good anamnestic response. Adverse effect is local pain, swelling, redness, less likely fever, headache, dizziness, or GI effects. Pre-exposure prophylaxis. It's a medical emergency. Warm-blooded animals like dogs, cats, cows, buffaloes, sheep, goats, pigs, donkeys, horses, camels, foxes, jackals, monkeys, mongoose, deers. Rodents not reported. So no contraindication given in pregnancy, infant, lactating women also. The regime which is followed is intramuscular regime for baby rabies post-exposure prophylaxis. In the previous slide also it was post-exposure prophylaxis. Essence schedule, the 5-dose regime 0, 3, 7, 14, 28. Zagreb schedule, the 3 doses 0, 7, 21. Influenza vaccine, post-exposure prophylaxis, intradermal. 2 sites intradermal regime. This is Thai Red Cross, dose 0.1 ml. Updated one is post-exposure prophylaxis IM administration 03728. Rabies immunoglobulins. So human rabies immunoglobulin dose is 20 international unit per kg, maximum of 1500 international unit. If not available, equine, it is 40 international unit per kg, maximum 3000. Category 3 wound, around the wound and remaining IM within 7 days. Special situations, immunocompromised patients, previously vaccinated patient, IM, intradermal, day 0 and 3, irrespective of duration of previous vaccination. Travelers, single visit, 4 sites, 2 deltoids and 2 suprascapular or thigh. This is the rabies vaccine, BRAP, purified virocell rabies vaccine. About pre-exposure prophylaxis. Continuous exposure. So lab personnel involved in research and production of rabies biologics. Frequent exposure, veterinarians, laboratory personnel involved with rabies diagnosis, medical and paramedical staff treating rabies patients, dog catchers, zookeepers, and forest staff. Infrequent exposures like postmen, policemen, and courier, travelers to rabies endemic countries. Pre-exposure, 3 doses IM, day 0728, intradermal 072128, continuous exposure, antibody titer booster if antibody is less than 0.5 international unit per ml. If serology not available, vaccination every 5 years. So this is the vaccination schedule. Okay. So we will just grab the opportunity to revise it fast so that at least the salient features should be registered in our mind. Okay. So these are the 10 vaccines we have spoken: hepatitis A, typhoid, HPV, varicella, influenza, rabies, meningococcal, Japanese encephalitis, cholera, and yellow fever. This is the vaccination schedule we follow. Varicella, it's a live attenuated vaccine. Okay, BioVac V is the trade name available. Apart from that, Varipede, Varicella, Valrix, Nexipox, Suvicella are available. Okay, and it is a 0.5 ml subcutaneous, 2 doses, minimum 3 months apart, up to the age of 4 to 6 years. Hepatitis A, 2 types of vaccines available. One is killed, another is live. Killed vaccine 2 doses, 6 months apart. Live vaccine single dose. Okay. Hepatitis A, both the vaccines are 0.5 ml intramuscular dose. Typhoid vaccines we have seen, polysaccharide vaccines and conjugated vaccines. We have seen oral vaccine also. Conjugate vaccine can be given after 6 months of age. Polysaccharide vaccine can be given only after completion of 2 years. And every 3 years, we have to keep repeating the polysaccharide vaccine. So this is the endemic areas they have shown how typhoid incidence varies worldwide, global burden. HPV vaccines, 2 types of vaccines. One is bivalent, one is quadrivalent. Now, Nonavalent is also available. So dose is little different. For bivalent, it is 0.16. For quadrivalent, it is 0.26. And Nonavalent is available in India now. Influenza, very important vaccine. Burden is very high. Should be given after 6 months of age with 2 doses 1 month apart and can be repeated yearly as per the condition of the child or depending on the endemicity. Japanese encephalitis, 100% permanent neuropsychiatric sequelae, very important disease to be prevented. Endemic areas should be taken care of. These are also 2 doses, minimum 1 month apart. Meningococcal vaccine, very important for travelers. And for this also, polysaccharide and conjugate vaccines are available. Conjugate vaccine can be given at any age after 6 months of age. And polysaccharide vaccine should be given after 2 years, single dose. This is about the meningococcal disease, to identify the primary case and how to calculate the primary attack rate and when it will cause, when it is important to inform, and when the patients in a small group or the population at risk in a small group should be vaccinated. Cholera, though in due course of time it has come down, but at the time of outbreaks, cholera vaccine becomes very important. This is the oral cholera vaccine. Yellow fever, though it is an exotic disease to India, but when you are visiting endemic areas like these countries, Africa or America, then we are supposed to get the vaccine 10 days prior to the travel. These are the contraindications and precautions to be taken. The rabies, very important to know about it. So, two types of schedules. One is Essence schedule, one is Zagreb schedule. This is about immunoglobulin. Two immunoglobulins are available. One is human origin, one is equine origin. Doses for human is 20 international unit per kg. For equine, it is 40 international unit per kg. And how it has to be given, it is followed for cat 3 wound, category 3, and it should be given in and around the wound, and the remaining should be given IM. Immunoglobulin can be given within 7 days of the dog or any rabies suspected animal. Pre-exposure prophylaxis is for whom? So those who are in continuous exposure, frequent exposure, and infrequent exposure. So they have classified the things in this category. So infrequent exposures should be known. It is like postmen, policemen, couriers, courier givers, and all. Frequent exposures, like they are frequently getting exposed to the warm-blooded animals. So like veterinarians, lab personals, and the dog catchers, zookeepers, forest staff. Continuous means those who are continuously in the research with rabies biologics. For pre-exposure also 3 doses IM 0728 or intramuscular is 072128 for intradermal, and continuous exposure antibody titer should be done. If serology not available, get vaccinated. This is for the continuous exposure. So vaccinated after 5 years of age, 5 years of duration. This is the national immunization schedule for India. Thank you.